Part 3, how my everyday headache led to my brain aneurysm. Share, save, like, and follow for more. This particular one, we're going to talk about testing. How do you determine what you have going on in your head? MRI are two different tests, and we're going to get into details. I mentioned this description before, and really a brain aneurysm is almost like a bubble on a blood vessel in your brain, and this is a really good description. This comes from the Brain Aneurysm Foundation. It's a weakness in a blood vessel in the brain which balloons and fills with blood, and we certainly don't want that to pop. Scan to Save is the Brain Aneurysm Foundation campaign just to prevent any kind of issues that you're having in your head. Just keep asking for an MRA or an MRI. What are some of the reasons why you would ask for one test or the other? First off, this is a great image and description of what an MRI is and the types of problems that could be detected from an MRI. This is definitely a longer test. You can read the description and pause it to do that. But for me personally, it was definitely longer than my family members who have had MRAs. This is also such a good description of seeing the similarities and differences of the two tests. And down at the very bottom, it says MRA is primarily meant to diagnose abnormalities in brain vessels, while MRI is used mainly to examine various organs and tissues, including the brain. So that just shows you the basic information. This description is exactly what happened to me. It says, when there is a possibility of having a brain aneurysm, an informed physician will generally request a scan of some sort. So I first had a CT scan. That's what led to the MRI. And then I had an angiogram, which is a much more precise look at your brain to know the exact size. Let me give you that. This is an angiogram. So this is the gold standard of all the tests. If you've been determined to have a brain aneurysm before having any procedure done and getting the actual perfect amounts. So down here at the very bottom, you can see that it's 10.65 millimeters. On the MRI, it showed up at about 7 millimeters. So you want to get that exact reading, but this is not a necessary test unless the MRA or the MRI were able to determine a reason to move forward, seeing a neurologist and getting a second opinion and getting the correct testing done. If you're having some of these symptoms with an unruptured brain aneurysm, problems seeing, double vision, numbness, weakness, balance problems, headaches, that's certainly what I was struggling with, pain above or behind your eye, widened pupils. I actually have one pupil that's slightly larger than the other, and trouble talking. This is me about 2 weeks after I had my brain aneurysm surgery. You can survive. This is about prevention. We're preventing a rupture here, and especially if you have any people in your family who are close relatives or even not close relatives, even a distant relative who has suffered with a ruptured brain aneurysm or knows that they have a brain aneurysm, you absolutely have to share this with your doctor. They're not going to just ask you. It will not come up naturally in conversation. You need to let them know, because then that will definitely give an opportunity to see that MRA testing is very common for folks who have people in their lives that have brain aneurysms. And I want you to take a look at the bottom here. If you're having any of these very serious conditions, you get to the hospital ASAP. So you can pause this and take a look at that.